Hi, I'm Dr. Nick Scotto with River City Physical Therapy, and today I want to talk to you about a very common diagnosis that people with low back pain get, and that is degenerative disc disease. It's also can be known as kind of an arthritic condition in the low back. Now, first of all, people with degenerative disc disease may or may not have sciatica with it. They may or may not have referred pain into their hip or buttock. Usually it's a disorder where people feel very stiff and achy in the low back, and they feel like they don't have the mobility or the flexibility that they want to perform different movements throughout the day. So by definition, it's actually a disorder of more of a stiffness than actual sharp pain. So with degenerative disc disease, what we find is that it's actually quite normal to have this as we get older. They've actually done studies where the rates of degenerative disc disease rise in the population as people age. But the good news is that it's found in people with and without back pain. So just because you have degenerative disc disease on your X-ray or MRI or a CAT scan doesn't mean that that's kind of a death sentence for you. It's something that's quite easily fixable with certain flexibility and strengthening exercises. The key to getting better with degenerative disc disease is performing a routine warm-up in the morning and in the afternoon for your low back. So doing specific low back stretches and exercises to kind of work that stiffness out. The other thing that you want to do is avoid prolonged static postures throughout the day. So if you're sitting for a long time at work, you actually want to break that sitting up and get up and walk around a little bit to loosen up the low back. You can also do some kind of slouching down and sitting up tall pelvic movements in your chair to kind of keep that low back area nice and flexible and moving throughout the day. You want to avoid that lazy boy or sitting on the couch for too long where you're kind of in that slouch posture, because that's going to make you stiffen up as well. Another thing you can do is to go on daily walks. When you walk and really swing your arms, you're moving your hips, you're moving your low back, and it's helping that low back area keep nice and loose. So if you've been diagnosed with degenerative disc disease or not sure what to do or haven't got the relief that you wanted, give us a call at 904-566-7070 and we'll talk to you about the problems you're having with your low back and see what we can do to help you. I hope you found this video good and informative, and I look forward to hearing from you soon.